All righty. Hello, everyone. Welcome to OtterTalk number 20, Dr. Starr Cameron's presentation on epilepsy and the FitBark device. We really appreciate you all coming. Very, very special thanks to Dr. Starr Cameron for doing this presentation for us. And a big thank you to Becky for coordinating it. We really appreciate it. And Becky, I'm going to have you go ahead and start by introducing Dr. Cameron.
Thank you, Robin. I lived with a seizing Otterhound, and I found out from that how difficult it is to relax and just enjoy life with your dog. And it's kind of a miserable experience. Because of that, I am constantly looking for information about epilepsy to share with friends, not only with Otterhounds, but other breeds, because I found out that it's not just Otterhounds that have seizures, it's other breeds as well. I find myself checking in with the Canine Health Foundation frequently to see what research is being done. And it was there that I found out about Dr. Starr Cameron's research. Sarah and I had a call with her, which was absolutely delightful. We enjoyed meeting her on the phone and hearing a little bit about her career in neurology, which included a study of sea lions that seized out on the West Coast. I was excited to learn that she's practicing at the University of Wisconsin, which is my home state. And so I'd like to not take any more of your time. I'm honored to introduce to you Dr. Starr Cameron.
Thank you, Becky, for the introduction, and thank you all for being here. I really appreciate that, especially on a Thursday evening for sure. So a little bit more about myself is that I grew up mostly in Wisconsin and actually attended Carroll University, which is a liberal arts university right outside Milwaukee. And then through my experience there, I studied abroad at the studied abroad in the UK and loved it, and ended up going back there for vet school. So I studied abroad in my undergrad, and that led me to go to vet school at the Royal Veterinary College. I then did an internship in private practice after vet school for a year, followed by a 3-year residency in neurology and neurosurgery at Cornell University. Following my residency, I went and worked in private practice at Sage, which is in the San Francisco Bay Area, for about 4.5 years. And during my time there, I also worked part-time at Stanford in their comparative neuroscience department, studying, as Becky said, epilepsy in sea lions. And through the techniques that I learned in that lab, I quickly realized that we were doing more involved studies on sea lions than had been done in dogs and cats to quantify and qualify the epilepsy and the changes in the brain that go along. So in 2017, I moved to the University of Wisconsin and have been there ever since. And that is now what a majority of my research focuses on, is the neuropathology associated with seizures in both cats and dogs. But for tonight, I'll be talking mostly about my clinical research, and in particular, the FitBark study. So I really like something called translational research. And in that model, traditionally, what that is taking things that we learn in lab animal models, most commonly rodent models, and then applying that to human medicine. But unfortunately, veterinary medicine gets completely skipped over. And so our veterinary patients, especially cats and dogs, are kind of neglected in this area. And so what I like to do is actually look at what we know, particularly in people with epilepsy, because that has been studied so thoroughly over the last several decades, and then take that information and say, does that actually hold true in our cats and dogs? And sadly, some very basic information is lacking in our veterinary research. And so my goal in my research is to fill those gaps and try and understand epilepsy a bit more so that we can make better targeted treatments, not only with medications, but other things outside from that as well. So what we'll do tonight, what we'll cover in the next 45 minutes or so, is an overview of epilepsy with definitions. We'll look at what we know about activity associated with epilepsy in people and dogs, sleep, and then exercise as well. And then for the second half, we'll delve into the particular FitBark study and what we learned from that. And then finally, we'll talk about our studies that are kind of building off of the FitBark study and what we're doing and working on now. So what is a seizure? Neurons are inherently excitable, and neurons are the cell in the brain that they communicate via a little bit of electrical activity, and they are ready to fire. And so although we don't know in any patient, human or animal otherwise, what exactly triggers a seizure state to a non-seizure state or a non-seizure state to a seizure, what is actually happening at that moment, we don't know. But we speculate that it's probably a lack of inhibition, so too much, a lack of dampening things down, or too much excitation, so excitatory neurotransmitters going bananas, or perhaps a combination of both of those. And so that leads to an increase in electrical activity, and all of the neurons start to fire at the same time, and that's what actually creates a seizure. And then the term epilepsy means that it's a condition where an animal has had at least 2 seizures that are at least 24 hours apart. And so oftentimes seizures and epilepsy are kind of used interchangeably, but that's the subtle definition and difference between the two. So idiopathic epilepsy in dogs, and that's the term I'll be using a lot tonight because that was our FitBark population. By far and away, it is the most common cause of seizures in dogs. And there are 2 major categories of idiopathic epilepsy in dogs. One is genetic, and that might be known. Currently, there are not commercially available tests to test your dog to say, you know, are seizures in this line? So most of the genetic seizures that are known are dogs that have participated in some sort of research study. The other way, and most of the dogs that we see where it's genetic are suspected, i.e. it's in the line, and perhaps there's a litter mate or another relative that has known epilepsy. And so then our index of suspicion is elevated in that particular dog. Also, if there's no genetic predisposition or no known, because of course, a lot of times people may get rescue dogs or get them from a breeder and then not know about the extensive history or relatives of the dog, whether there are seizures in lines or things like that. So otherwise, idiopathic epilepsy means we don't find any other reason for it. And this can be confirmed, meaning that a dog has had an MRI and a spinal tap, and everything is unremarkable or normal. Obviously, every dog with seizures does not have an MRI, nor would that even be recommended. So a lot of the dogs, most of the dogs with idiopathic epilepsy fall into this presumptive category. And most dogs with idiopathic epilepsy will have their first seizure between 6 months and 6 years of age. There are definitely dogs with idiopathic epilepsy that may seizure earlier or later than that, but the majority of dogs fit into that criteria. The other 2 major criteria of a presumptive idiopathic epileptic dog is that they're normal in between their seizures. So the owners aren't reporting any behavior changes or any signs of personality change or things like that. And then our neurologic exam that we perform is also unremarkable or normal. And papers have a variety of prevalence listed. Some of it depends on the breed or the population of dogs that they're looking at, but it has been reported to be in up to 7.5% prevalence in dogs. So unfortunately, not rare by any means. The other types of reasons that dogs can have epilepsy are broken into 2 other major categories. The first one's called structural epilepsy. And you could think about this as things that are actually affecting the brain directly. So congenital malformations, infectious disease, immune-mediated like encephalitis, cancer, trauma, or strokes, vascular events would all be under the structural epilepsy category. And then the last category we have are called reactive seizures. And these are things like toxins. So you can think about like lead toxicity, for example. Fortunately, we don't see that as commonly as we used to. But that would be an example of a toxicity that can lead to seizures. And the reason that this specific group is called reactive seizures and not epilepsy is, in theory, if you correct these disturbances, then the seizures will stop. So if you have a dog with lead toxicity, for example, and clear them out with IV fluids and things like that, then in theory, they should stop having seizures. So this is not actually an underlying epilepsy disorder. So that's why it's called reactive seizures. And again, the population that we'll talk about will be that idiopathic epileptic group. But just to be complete, there are a lot of other reasons that dogs can have seizures. So anti-epileptic drugs, which for a lot of the slides will be abbreviated as AED going forward. And this is the mainstay of treatment in both human and veterinary epilepsy. And in our veterinary medicine, we consider a success when there's a greater than 50% improvement in the seizure frequency and or duration. So having fewer seizures in general or having shorter seizures and a cut by 50% would be considered success implementation of a drug in particular. And then we have 4 major commonly used anti-epileptic drugs: phenobarbital, potassium bromide, zonisamide, and levetiracetam, or Keppra, as the trade name is. And in spite of these medications and even polypharmacy, so dogs that can be on multiple medications, still approximately a quarter to even a third of dogs with epilepsy still have poorly controlled seizures, and they're still considered refractory in spite of being on those medications. So activity. This has been studied a lot in humans because people with epilepsy report increased fatigue and daytime drowsiness, and that they're 1.4 times more likely to be physically inactive than the general population. And approximately 60% of people with epilepsy are physically inactive, so no exercise or activity other than daily routine. There are also a lot more sleep disturbances, which we'll talk about that in a future slide as well. But that, of course, contributes to daytime drowsiness. If you're not sleeping well, you're definitely going to be a lot more tired. And then a lot of studies have been done looking at the medications, and are certain medications more likely to make you sleepier or not? And yes, that's true. Phenobarbital and higher dose levetiracetam or Keppra are associated with making you even more sleepy. And zonisamide in particular makes you less sleepy. So what do we know about activity in dogs? Owners report a decrease in activity, and there's very little information out there about this, and none that really quantifies this information. But it has been reported in a study that when owners found out that their dog had epilepsy or was diagnosed with epilepsy, they actually cut back on their dog's activity. And so a lot of this is it actually a real decrease because of epilepsy? Is it because of the medication? Is it owner driven? Like, what is the actual cause of the decrease? And it's probably multifactorial. And there have been surveys, especially in the last 5 years or so, looking at quality of life as perceived by the owner of their dog with epilepsy. And sedation, lethargy, and increased sleepiness have all been correlated very, very tightly with lower quality of life scores in those dogs. So it's definitely an area of concern in our dogs with epilepsy. But how sedate are they really? And it's something that we know when we talk about starting a dog on medication, that some of our medications, we expect them to become more sedate, but we don't really know what to tell owners. What does that mean? Does that mean your dog's going to become complete couch potato, or does it mean that they're just going to be a little bit less active? So obviously that, being sedate is not something we want for our dog, but what does it mean? And again, we don't have that information. So this led us to our first study question. Do dogs with idiopathic epilepsy that are receiving medication have a decreased activity compared to age and breed matched controls? We would speculate and think maybe, but this has actually never really been looked at and definitely hasn't been quantified before. So a very simple question, but again, hadn't been answered in veterinary medicine before. So the second part of the study, sleep and seizures. And I know that this was a couple of the questions that Becky had sent. So this is a real interest of mine. And the relationship between sleep and seizures is deep and complex. It's also bidirectional. So a lack of sleep will cause more seizures. And people with epilepsy have poorer sleep quality, and we know that. And yet more seizures happen during sleep. And that's true for our idiopathic epileptics. And that was one of the questions that was asked is yes, and that is part of it. This is actually, although it's been studied a lot in humans with epilepsy, there are still not hard and fast conclusions drawn as to why this is. Our thought process at the moment is, at least in people, that probably we reach a new level of inhibition when you're sleeping. Basically, your brain is switching off, right? And so it's easier for this group of neurons to fire inappropriately and not be down-regulated. So because things are asleep, that it's more of a chance for seizures to actually happen. So in people with epilepsy, poor sleep quality has been very well documented, and that's with or without medications being involved. People with epilepsy report 2 times the number of sleep disturbances, so apnea, REM sleep disorders, restlessness in sleep, as well as insomnia. And even sadder is that children with epilepsy have 10 times more likely to have sleep disturbances than their age-matched colleagues. So if you look at all the studies that are done in people with epilepsy, there's 2 major ways to study sleep. One is a questionnaire. So when you wake up, how did you sleep? How did you feel? Did you feel like you were restless? Do you feel refreshed? Do you feel awake? They can also give them kind of tasks to do. Of course, this is not something we can, unfortunately, can't ask our dogs and cats, how well did you sleep last night? Do you feel rested this morning? So questionnaires don't work for us. Another way of studying sleep are sleep clinics. And in people with epilepsy and sleep clinics, not only are they videoed and things like that and hooked up to ECGs, monitoring heart rate and things like that, but they're also hooked up to things called EEGs, which are electroencephalograms, which are a lot of electrical sensors that are placed all over the skull. Because dogs have fur, and even when it's shaved down really well, the little adhesive doesn't stick for these. So we actually have to use little needle electrodes in our patients to do EEGs. Also, dogs' muscles on the top of their skull are a lot thicker, and their skulls are a lot thicker. And so because of that, we get a lot more what's called interference. And we really only can assess the top centimeter of brain activity when we do an EEG. As you can imagine, a dog is not going to be very tolerant of having a bunch of needle electrodes in their head area. So that's another technical challenge that we have. So for this reason, sleep clinics in dogs don't really work either. So we know that dogs with idiopathic epilepsy, most of them have seizures at night. A study that looked at trigger seizures, which we'll talk about what that term means in a minute, but sleep deprivation was shown to be a trigger for some dogs. And if they didn't have enough sleep or they had a sleep disturbance for some reason, then they were more likely to have seizures in a subpopulation. But other than that, we don't really know if they have different sleep quality, or are they more restless or less restless. We have no idea. So this led to our second study question. Do dogs with idiopathic epilepsy have better or worse sleep quality compared to age and breed matched controls? And the reason that we were keeping this as an open-ended hypothesis, i.e. better or worse, is in people, as I reported, it's worse, but our medications tend to make dogs more sedate. So the other side of the coin is, hey, maybe they actually sleep better than a control dog because of the medications. So we have that as a two-ended hypothesis. And then lastly, exercise and seizures. So back in the 60s and 70s, it was documented in people with epilepsy that there was a subpopulation where they would exercise and have a seizure. And as you can imagine, that would be incredibly dangerous, whether you're running or you're on a bicycle or whatever. If you're having a seizure and you're doing physical activity, that could be dangerous or even life-threatening. So because of that, for decades, and even it actually in a lot of clinics still is recommended for epileptics not to exercise. And because they were really scared, rightfully so, that if they recommended a person to exercise and then they had a seizure, that it would be, really, really bad. So that was the train of thought, the rationale for about 30 plus years. And the number of seizures that were actually reported were pretty low. So more recent studies showed that about 2 to 10% of patients have exercise-induced seizures, meaning that they have a seizure more than 50% of the time they exercise. And 10 to 18% of people had a seizure either before, during, or after exercise. So definitely not a majority of the population. So in the last decade, they have actually been prescribing exercise to people with epilepsy. And most of the studies involve aerobic activity or yoga or a combination of that. And they have done them quite a few studies in women as well as children with epilepsy. And all of the studies that have been performed with this prescribed activity show a reduction in seizures during the time of exercise as well as afterwards. So the seizure frequency is actually reduced, which is fantastic. And all of the patients have shown an improved quality of life score. So what do we know about exercise in dogs? Again, there is very limited research, and trigger seizures have been reported. And so I mentioned that term earlier. And what that means is that there is an event that can reliably, more than 50% of the time, cause or trigger a seizure in a dog. And more common triggers that we frequently hear about or reported to us from owners are things like going to the groomer, going to the vet. Unfortunately, we have a couple of those. And then also like people visiting the home, people staying in the home. And so those things could be triggers and stressful / anxiety events. And again, exercise has been reported as a trigger. So for example, a trip to the dog park or something where the dog is exercising more than before, but in a very small population of the one study that's out there that talks about trigger seizures in dogs. So this is really the crux of the study, and what we were really looking at is, does exercise decrease seizure frequency in dogs? Just like Becky was saying in the introduction, we are always looking for things outside of drug therapy that could help our epileptic population. The drugs have a lot of side effects, and so if we can find alternatives, that's a goal in both people with epilepsy as well as my research too. So what did we find? How did we do this? So part one, we're going to look at activity and sleep. So just as a reminder, we wanted to look at our activity levels of dogs with epilepsy receiving drugs and compare those activity levels to age and breed and sex matched controls. So we know that a bulldog is not a border collie in activity. And so we didn't want to group all these dogs together. So we actually had control dogs. And the way that we got our control dog data was to contact FitBark, the website, because they have millions of dogs that are enrolled with the device. And so we were actually able to give them the signalment of our dogs. So we gave them all of the breeds, all of the ages, and the sex of each individual dog. And we had them match at least 5 control dogs for us. And those dogs could not be on any medications or have any diagnosed condition. And that's part of FitBark enrollment. You can add that stuff in on the app when you enroll your dog for a FitBark. And so the reason that we got 5 dogs is because obviously a lot of dogs' activity is based on human activity. Some of us are more couch potatoes, some of us are more athletes. And so we felt like getting 1 or 2 dogs may misrepresent dogs' activity. So getting 5 would kind of get around any kind of outliers that we might have. And then we also wanted to qualify and quantify the sleep quality in dogs. So are they more restless? Are they not? And if so, how much? So this is what the study looked like, this part of the study. So we recruited dogs with idiopathic epilepsy. And then we ended up enrolling a total of 82 dogs, and they were, we fitted them with the FitBark device, helped set up the app on their owner's smartphone. And then we were able to connect the app to the university website, our online account with FitBark. So we were able to see the information that the owner saw. And so we could get the information, didn't have to bug the owners every week to collect that information. And for the first 3 months, this was an observation period. We didn't ask owners to do anything different, just have their dogs wear the FitBark. And as I mentioned, our control database were these control dogs without any pre-existing medical conditions on no medications. If it was a mixed breed, so for example, if an owner had a shepherd mix, then the dominant breed was used, i.e. a shepherd. We took 3-month averages, but we actually collected weekly data and then averaged that over 12 weeks. And for each dog, 5 control dogs were evaluated. So FitBark calls their activity bark points. And the way a FitBark works is the technology is an accelerometer, just like a Fitbit, like most of us have, or Apple Watch, or any sort of device that's measuring your activity. The data is actually records multiple readings per second. And initially FitBark was using that second data, but as you can imagine, it was too much data and blew up their server. So they realized that they actually had to store it in minute segments instead. Still a lot of data when we're talking about 82 dogs. And the reason that they call them bark points and not steps is that the device is not on a limb, it's on their collar. And then the way we use the sleep score is when you enroll or set up an app on a smartphone for FitBark, it automatically sets up the sleep window to be 12 a.m. to 4 a.m. during this 4-hour window, but you can customize it if you have, work third shift or things like that. And the device calculates a % of time spent restless during this 4-hour period. So for example, if a dog was restless for a total of an hour during that 4-hour period, then that sleep score would be a 75%, saying that 25% of the time the dog was moving around. And so our endpoints, where we're looking at these bark points, which we call activity points, again, we collected that data weekly over 3 months, and then exactly the same thing for the sleep score. We enrolled 82 dogs, as I mentioned, and we had a few dogs that fell out of the study for a number of reasons. For 8 dogs, FitBark did not have at least 5 controls that were age, breed, and sex the same. Also, we did this analysis a little bit earlier, and 8 dogs had not completed the first phase. And then 3 dogs had their medications discontinued, and that part of our criteria was they needed to be on at least 1 drug. And then 1 owner was actually concerned after putting the FitBark on her dog that there was an increase in seizure activity. And so after 2 to 3 weeks, she pulled her dog and herself from the study. So we ended up with 62 dogs, which in veterinary medicine is a large study. Most of them are single digits, unfortunately. So we were still very happy with that number and felt like we could get meaningful data. So what we found when all dogs were considered, all dogs on all medications, any combination, there was a very significant decrease in activity in the epileptic dogs compared to their age and breed match controls. And depending on the drug and combination, which we'll talk about in a couple of slides, that decrease was between 11 to 26% in activity. And just to show that in graph form, on the left here, we have our epileptic population and their average daily, bark points or activity points were around 6,700. And then in their age and breed match controls, they were around 8,200. And again, this is all dogs on all different kinds of medications. We did a subgroup analysis where we looked at certain medications and certain combinations of medications. And the one that was the most significant is the combination of phenobarbital and potassium bromide. Those dogs had an 18 to 39% increase in their activity. So that was a pretty significant, think about the minimum being almost 20%, pretty significant decrease in activity compared to the controls. When we looked at sleep, it actually was not statistically significant. So some of our epileptic population were more restless, i.e. they had a lower sleep score, and some of them were less restless, had a higher sleep score. So when we averaged all of them together, there was no difference in this population. So no statistical difference in all dogs, as well as when we did the subgroup. We looked at the different drug levels as well, and no drug seemed to really make a significant difference. And here are the results for our sleep. So we have our epileptic dogs on the left, and they had an average sleep score of almost 85%. And then our control dogs on the right had a sleep score of an average of about 84%, so just 1% in it. So what do we conclude from this part of the study? Similar to people, dogs receiving medications with idiopathic epilepsy did have significantly decreased activity levels compared to controls. And just like people with epilepsy, there were differences between different drug combinations. And this is the first study to ever quantify these differences in dogs. So not to just say, yeah, dogs will be more sedate, but how much more sedate? We actually have numbers and percentages for those. And the way that this helps veterinarians and neurologists like myself is that it can set appropriate owner expectations. So we can actually give you guys better information. And again, not just say they're more sedate, but about 20% more sedate on medications. And this also can help us select the better drug, because we know some of our drugs, especially based on this data, are going to be more sedating than others. And so perhaps we intentionally pick a less sedating drug, especially for a working dog or agility dogs that have jobs that need to be on more. And then so far, unlike human medicine, our study did not show differences in sleep score between dogs with idiopathic epilepsy and compared to controls. So for the second part of the study, part 2, we looked again at exercise and seizure frequency. And then because we had the FitBark, they were wearing it anyway, we also decided to look at sleep just as a secondary aim. So our primary aim, and again, the real crux of the whole FitBark study to begin with, is to compare the number of seizures in a month between periods of normal activity and a prescribed increase in activity in epileptic dogs compared to a control group of epileptic dogs. So here we have a slightly different population, and in the next slide, I'll kind of show what that means. And then again, while we were at it, we're also looking at the sleep quality in dogs with epilepsy during times of normal activity and a prescribed increase in activity. So our first phase of the study that we previously talked about is at the top here, phase 1. And then for phase 2, that was another 3 months, but months 4 through 6. And what we did is we randomly assigned dogs to either be in the control group, and we asked owners to just, again, continue their normal routine, or to be in the treatment group, which we ask them to do a 20% increase in activity. And so what we did to calculate that is we went and got each dog's individual weekly activity score and how many bark points they were on average. We calculated the 20% increase for the owners and then gave them a target to reach. So we said, hey, if this is your new goal, and if you could, and we gave them some ideas of how to do that as well, but ideally, if you could increase by 20% and get to this number of bark points on average per week, that's what we're looking for this study. And then at the study conclusion, the FitBark device, we offered owners to buy the device if they wanted, and we gave it to them for the same price that we paid for it from FitBark. And then we also ask owners to turn in their seizure logs or seizure journals, which is a part of standard of care for having an epileptic patient. All of them owners are used to keeping a seizure diary for them. And so our endpoints, like what are we looking at, were the number of seizures per month and then the number of seizure days per month. And that may seem a little nuanced, but the reason for that is sometimes dogs will have multiple seizures in one day. And as neurologists, we count that as one seizure event. It's called cluster seizures technically. And so if we had a dog, sometimes it can be 5 or 10 or even more. So we wanted to count that as one seizure event. And so that's why we're looking at the number of seizure days per month. We didn't want dogs with a lot of cluster episodes to skew the data. And one note I will say is, of course, this is reported by owners. We all sleep. Some work from home, some don't. A lot of people work outside the home. And then, of course, we have to go to the grocery store and all of these other things. So it is absolutely possible and probable that seizures are missed, especially with seizures happening at night. That is an absolute possibility. And then sleep quality, we're again looking at that sleep score and calculating it, looking at the weekly average over a 3-month period, just like we were in phase 1 of the study. So again, we had those 82 dogs enrolled. Unfortunately, we lost 6 dogs over the 6 months of the study. 4 were due to refractory seizure activity, 1 to liver failure, and 1 the owner found the dog had passed away. 3 dogs discontinued their medication. 3 owners did not turn in seizure logs or seizure journals. And then we still have that 1 owner who removed her dog from the study. So we ended up with a total of 69 dogs in this part of the final analysis. So what did we find? So dogs in the exercise group, our treatment group. So sadly, owners did not increase the activity as much as we asked them to. And overall, there was only a 3.5% increase in activity, not a 20% increase. I shouldn't be as surprised about that because really, if I'm asking a dog to exercise more, I'm asking a human to exercise more, but it was still a little deflating. And here are those results. So what's interesting about this is that our control group, I want to give people a little bit more credit, because in our control group, which is the blue line here, so again, those are our epileptic dogs that we ask owners just to keep with the same routine, you can see that their activity actually decreased a little bit. And that's really commonly reported in people with Fitbits or other activity monitoring devices, that when the novelty wears off after about 3 months or so, then you go back to your baseline activity. And so we definitely see that here in our dog population as well, which is really interesting. So overall, our treatment or exercise group did increase, and it was, a little bit, but by no means was it 20%. However, in spite of that, we still had a significant increase of 0.34 seizures per month in the exercise group compared to the control group, which was surprising. And I made my statistician run that a couple of times, make sure there was no errors or anything missed there, because that is not at all what we were expecting. In addition, we looked at dogs that had at least a 10% increase or above. And there were actually 11 dogs that had their activity increased by at least 10, 20, or a few even 50% increase in activity. And of those dogs, there was even more statistically significant increase in seizures. So the seizures increased by 0.55, but our p-value is even lower, suggesting that this relationship is real. And then when we look at the seizure days per month, there was also a significant increase of 0.326 days per month, again, being statistically significant, even in these in this partial complier group. And so this is what that data looks like with our partial compliers, meaning they had at least a 10% increase in activity or more in this orange line here. So you can see that their seizures per month are going up. And then in our control group, the seizure frequency is actually going down. So this was a statistically significant difference. So when we looked at sleep, as expected, if dogs are exercising more, then their sleep improves, just like all of us. So what's interesting is that in the exercise group, during the months 4 through 6, there was a statistically significant increase in sleep score by 1.2%, but it was statistically significant compared to the time when they were not having their increase in activity. So what can we conclude from part 2 of the study? When prescribing a 20% increase in activity in dogs, owners will, on average, increase activity by 3.5%. So perhaps in the future, we need to aim for 50% or something more than that. Because yeah, and we had very well-intentioned owners, very well-intentioned people. We sent out reminder emails and all sorts of things, but I get it. I'm a dog owner myself, so I understand what that is a huge ask. I totally get that. However, we did find that compared to our control group, the seizures per month significantly increased in the dogs that did exercise more. This was contrary. This is not what we wanted to find, contrary to our hypothesis. And then our subgroup analysis, when we looked at those partial compliers, the ones that had at least 10% activity or more, there was an even stronger p-value, suggesting that that relationship is real. It's not just something that's buried in statistics or by chance, that it actually is, unfortunately, a real relationship. And then we found that dogs, when they exercise, do have higher sleep scores, i.e. improved sleep, compared to times when they're not exercising. And again, not what we wanted to find. So where are we now? So just less than a week ago, we did an additional data analysis on this group of dogs. So it's one thing to say we increased activity by questionable amount of percentage per dog, more seizures were noted, but is that relationship real? Is it related to activity? What is exactly happening? And in people with epilepsy that have seizures associated with epilepsy, usually the seizure is going to be within 24 hours of the exercise or the increased activity. And so that's what we did. We compared the activity in that day before a seizure to the dog's baseline activity. So we said, okay, we've got all of this baseline data for these dogs. Is, number one, there a difference in the amount of activity they're doing on the day before a seizure? And if so, is that more likely to cause a seizure compared to other days that they're exercising? And I apologize, this data does not look very pretty because it is from my statistician and not ready for a paper just yet. But I wanted to show you guys some of the results because they're interesting. So we have 3 separate groups of data here. The pinkish salmon color means that they're the dogs that had an increase in activity the day before a seizure. And then the blue category means that they didn't have an increase. And what we see is we have a 0% or more, so 1% should be or more increase in activity, a 20% or more increase, and then a 50% or more increase. And that's from each individual's dog's baseline activity level. And as we can see, I don't have the p-values here listed, but as their activity increases, and especially from that 20% to 50% from baseline, there was a very significant increase in seizure incidence. So it does appear that the more activity they have, the more likely that they will be to have a seizure in the 24 hours following that activity. So what are our takeaways from this study thus far? So dogs with epilepsy on medication have reduced activity compared to control dogs of the same age and breed. There was no change in sleep quality in epileptics on medications compared to controls. With increased activity, there was a slight but significant increase in the number of seizures in dogs. And so then, of course, the big question is, should I not exercise my dog or should I not exercise my dog with seizures? And we definitely recommend exercise for sure. But if there is an increase in activity, significant increase in activity, consider being on alert for a possible seizure. So I'll give you a perfect example. I have a patient named Annie who goes on runs with her mom, and she's a border collie, and Annie can do the weekly runs, which I think are around 3 miles, but mom goes for a really long run on the weekends, 6-miler, and anytime she takes Annie, she's guaranteed to have a seizure that evening. So it's something that if you have your dog's baseline activity, regular exercise, regular trip to the dog park or walks or things like that. But if there's something additional, let's say you go for a really long hike or a lot of extra activity, then there is the potential that there would be an increased likelihood of potentially having a seizure. So this was part of the study that I was really excited about, but it did not logistically pan out. And I'm sad about it, but I do have some information that I can give you guys. It just unfortunately is not publishable and it's not paper manuscript ready. But one thing that I wanted to look at is evaluate the FitBark device as a seizure monitoring device, because as I mentioned, we're all busy. We don't spend, most of us can't or don't spend 24/7 looking and monitoring our dog. And so it would be great to have a device that catches seizures and put your mind at ease. As Becky said, worrying about having a seizure, is dog going to have a seizure, huge stressor, absolutely. And so we were hoping to be able to evaluate the FitBark device as a seizure monitoring device. So unfortunately, because of what we would need to say definitively that dog has a seizure would be video evidence of it. And so that would be putting up cameras in people's homes and or we talked about even having the dogs wear like a GoPro or something, but of course that's privacy issues. I don't think that anyone would want researchers seeing their home and their private lives and all of that. So unfortunately, that was not a logistical study that was going to work. I will say that quite a few of the owners did use the FitBark for this purpose. And to take one step back to explain why we need video evidence, if it's even dogs having seizures in the middle of the night, which again, most do, we couldn't say that he wasn't, scratching an ear or just moving around or licking a paw or something like that to show an increase in activity. So that's why we needed that video evidence that it was really a seizure. However, as I mentioned, some owners shared their FitBark data with me and how they were using it, saying that they could absolutely, and their FitBark data was beautiful in regards that, it'd be middle of the night, and then you see a huge increase in activity over just a minute or two, and then right back down. And so quite a few of our FitBark owners were then using this, and that's why a lot of them decided to keep the device after participating in the study, because it did provide some peace of mind for when they weren't actually with their dog. So other studies that we're doing are pathological studies, and this is actually a cross-section of a sea lion brain. And so what we're looking for are changes within this little area down here called the hippocampus. And my bench-based research is focused in doing studies like this, where it's a post-mortem study. So of course, we're not doing this to any live dog. It's after they pass away. We're doing special stains to quantify the different neuronal cell populations. So what types of neurons are in different regions of the brain. And again, particularly focusing on an area within the hippocampus, which is a known seizure propagation zone. So when seizures happen and they get to this area of the hippocampus called the dentate gyrus, then they spread like wildfire all over the brain. So we're trying to figure out the cause and effect relationship. Are there changes? Are the changes there because of seizures, or are the seizures because of the changes? And this study is currently funded by the Canine Health Foundation, part of the American Kennel Club, as Becky alluded to in the introduction, where she found my information starting. So we have quite a bit of tissue collected. And so we're getting it stained right now and mounted. And then we actually have a wonderful veterinary student that will be working on this project over the summer, helping us to analyze and quantify all of that data. And we're doing a similar study in cats as well, so looking at cat and dog brains. Another study that we're doing is looking at probiotics. And I know that was another question that came up. It's a hot topic, microbiome, the microbiome and the gut-brain axis, huge. Currently we have baseline studies looking at the microbiome in epileptic population of dogs. But what our study is doing, and we're actually enrolling starting this week, is we're looking at, does a probiotic reduce seizure frequency in dogs? So if we give a probiotic, will that actually help reduce seizure frequency and or severity? And then as a secondary aim for that study, we're going to look at the microbiome. Does it change? Does it change in dogs with idiopathic epilepsy that receive this probiotic? So is the probiotic actually doing anything? And so unfortunately, fecal samples have to be dropped off every 6 weeks. And we have not figured out a way to have them mailed yet and preserve what we need to preserve. So unfortunately, you need to be within the radius of University of Wisconsin-Madison, where you'd want to drive every 6 weeks to drop off a sample. We've currently enrolled about 33, I believe, dogs in this study. And it is a year-long study that they will be participating in. So hopefully around next year, this time, we'll have our results coming in for that. Thank you. Thank you so much for attending. I hope that was the right amount of information. I see we're right on time, so that's good. And I really want to thank Becky. Sorry, she had to hound me a couple of times, but I was waiting for my manuscripts to get where they needed to go. I also want to give a huge thank you for all the collaborators on the study. 82 dogs enrolled for a prospective trial is a pretty big undertaking. I had 2 wonderful veterinary students who graduated in the summer, and so they're now veterinarians, Megan Berry and Kylie Grady, who were instrumental. Sean, my stats guy, and then Dr. Heidi Barnes and Lauren Trepanier also helped with designing the study. Amanda Brooks is one of our technicians who was also really helpful in owner communication and collecting FitBark journal or seizure journals for us. The FitBark study was funded by the University of Wisconsin-Madison School of Veterinary Medicine Companion Animal Fund. And just, I probably should have said this as a disclaimer at the beginning, but I do not have ties to FitBark. I don't receive any anything from them. They didn't fund any part of the study. We purchased the FitBarks. We did purchase them. They have a research rate that's slightly reduced from the market price. But yes, we are not tied with FitBark in any way. And then last, but definitely not least, all of the dogs out there with epilepsy that keep my research going, and I'm really passionate about this, and the owners that take care of them, which I completely understand is a big, big undertaking. It's not easy at all to have a dog with seizures. So I'm happy to take questions. These are my little ragamuffins, Nora, Ollie, and Sadie. And so, yeah, I'm happy to take questions. And then also, I know Becky had asked about, and I think this will be sent out in the email as well, but there are 2 different ways that you can donate to our epilepsy research. One is online via the link here, or if you'd like to send a check, then you can send them to Pat Bowdish, who is a part of our advancement team at UW.
Thank you so much, Dr. Cameron. Awesome. And yes, we will be, when I send out the follow-up email, I will be including that link along with the instructions in my email with the link to the YouTube video. We do have a couple questions specifically about the FitBark. What can the FitBark monitor?
Yeah.
Can you tell us a little bit about that?
Absolutely. So I guess to ask a question on a question, do you mean like diseases or?
So the question is arthritis, pain. Does it give the owner an alert to an upcoming seizure? Can it detect stress or anxiety?
Great questions. So yes, there have been publications on the FitBark for several of those things. They use the FitBark to look at dogs with arthritis. And so although the FitBark doesn't detect arthritis per se, what it was used for is to compare activity levels in dogs with osteoarthritis to dogs without, and found that there was less general activity. So the way that that could be translated to be used for an owner is that you could have your dog have a FitBark and then see if it changes over time or with the development of any sort of ailment. So for example, a torn cruciate or arthritis or anything else, to see. That's the way it would have to be used for your own individual dog, but it was used for research purposes for arthritis. Along the same lines, as far as anxiety and stress, same sort of thing. So they did show that, especially separation anxiety, owners were able to use the FitBark to see that when they left, their dogs were going bananas. And so that was something that owners didn't know. You know, sometimes your dog doesn't want you to leave, and it's like, okay, are they calming down 30 seconds later, or is it like 3 hours spent like this? And so the FitBark will allow you to see that data and how active the dogs actually are. As far as it being used for seizures, again, some owners did notice a huge spike, and I think the peace of mind that it provides is very, very valuable for that when we're sleeping and when we're not with our dogs. But so far, we have not done studies to actually say, does it reliably detect seizures? And that's one of the things I wanted to do, but we couldn't do because we didn't have video evidence. There's another study that was done by a colleague and friend of mine, Dr. Karen Muñana at NC State, where she was looking at a different activity monitoring device, not the FitBark. And what she had to do for that was actually put dogs and keep them in kennels in more confined space with a video camera on them, so that a seizure could be documented during that time. So very different study, but that's what we realistically need to say if the FitBark would work for a seizure or not. Because otherwise it's like, oh, are they just scratching their ear or licking their leg, or is it actually a seizure? Because it doesn't really differentiate that.
Does the FitBark mostly monitor the dog's specific activity, like physical activity and movement?
Absolutely. Yeah, you can definitely think of it, and it translates almost identically to a Fitbit, or in people like or an Apple Watch, where you see your steps per day. They just don't call it steps because it's not on the dog's leg. So that's why they actually use bark points, which I think is really cute. So they use bark points for their activity levels because it's on the dog's collar.
All right. So because of that, it would not monitor like pain or give you a forewarning of a seizure. It would
Correct.
just read out on the dog's physical activity.
Exactly. You got it.
Cool. One of our participants wants to know if there's a specific or type of probiotics that would be recommended for potentially making a difference.
Yeah, so I can say that we are using in our study VisBiome, and it is a well established. They have some research behind them. It's a veterinary product, and so that's the one we're using for our study. So far, our study will be the first study to look at, does a probiotic help dogs with epilepsy? So we don't know that information just yet. In people, there has been significant link between improving your gut microbiome, and reducing seizure frequency. So we're really hopeful that that'll translate over to dogs, but we don't know that information yet.
Great, thank you. Here's a question. What causes a dog to start seizing at an older age? It
Yeah.
seems like there is a significant number of Otterhounds that start at around age 6 or 7, though we still have some that begin at a young age. Is this a different type of seizure?
Great question. So most of our dogs have idiopathic epilepsy, meaning we don't find an underlying cause or it's genetic. And those dogs, almost all of them, will start between 6 months and 6 years. Um, when we get outside of that age range, to be perfectly honest with you, between the ages of 6 and 9, we don't have good research for that. And some of them are just, we call them late bloomers. They're late onset idiopathic epileptics. And some of them have more scary things like brain tumors. We know in dogs that are 9 years and older, about 70% of them will have a brain tumor. If they start having seizures at that age, about 70% of those dogs have a brain tumor. The other 30% will have a stroke, maybe a late onset epileptic, infectious disease, inflammatory disease, something else in their brain. But again, that 6 to 9 age range, we actually don't have very good information for. And so the important thing is, if you had an Otterhound that was older than 6, making sure that they were behaving normally at home in between the seizure events, and that on their exam at the vet, that there were any deficits picked up on their neurologic exam. And those are our other 2 criteria for calling a dog an idiopathic epileptic. Because if they're abnormal at home in between seizures and or they have deficits on their neuro exam, we get worried about something else, like a tumor or a stroke or something else in the brain.
Excellent, thank you. The next question is with regard to stress and its role in seizures. Are dogs that are more stressed more likely to seize, and is there anything to do to avoid it?
Really good question. Interesting question. So it's there are a few studies out there that have looked at this, and the reason for it is that in people with epilepsy, there is an increase in other psychological conditions, anxiety, even things like OCD, compulsion, stuff like that. And so currently, there's a line of research looking at that in our dogs with epilepsy, and definitely in certain breeds, border collies, there are more behavioral issues in those dogs, chasing their tail, biting their tail, problematic anxiety showing behavior in dogs that have epilepsy compared to dogs that do not. And so it could be something that happens in addition to epilepsy, because that's what we see in people. And as far as what to do about it is, if you can, reduce any of the stressful events as much as you possibly can. For example, we have a few dogs that we see that the vet clinic will cause a seizure. And so what we actually do, even before COVID, is we see those patients in the parking lot. We try and prevent them coming into the building, the white coat phenomenon, all of that, to reduce their stress as much as humanly possible. Unfortunately, for us to prescribe medications, we have to see them at least once a year. And so we work around that as much as possible. But I definitely know owners that have had groomers come into their home rather than going to a groomer, and just avoiding that situation. I had one dog that when the doorbell rang, he would go bananas, get super stressed out, and then go into a seizure. So they had to disarm their doorbell. So anything that you can do to reduce that. And if it's something that's unavoidable, so example, going to the vet, sometimes we can give what are called rescue medications beforehand to try and do everything we can to prevent that, with, again, things that are avoidable, which I know everything's not.
Excellent. Following up on that, we see a fair number of Otterhounds with trigger seizures only when stressed, like going to the vet, etc. These dogs do not typically seize during sleep. Would you consider this idiopathic epilepsy?
It would be, as long as nothing else is going on within the dog. Yeah, it's interesting. In dogs with epilepsy, idiopathic epilepsy, they can have little seizures, called focal seizures. They can have generalized seizures. They can have really bad seizures, and everything in between. So there's no typical seizure presentation for a dog with idiopathic epilepsy.
Okay, thank you. Is there a difference between dogs that seize when sleeping and those that seize when not sleeping?
So dogs with idiopathic epilepsy are more likely to seizure at night. Not all of them do, but that's definitely the majority. I will say dogs with other underlying conditions, such as tumors or vascular events, timing doesn't seem to matter as much. It could really be anything. So it doesn't necessarily, if a dog is seizuring during the day, it doesn't mean that there's something going on, but we do see more seizures at night in our idiopathic epileptic dogs compared to dogs with other underlying pathology.
Thank you. Do you think there is a different genetic cause for dogs with trigger seizures versus more typical seizures at night?
That is a really interesting idea, and perhaps, absolutely. So whether it's a genetic cause, which is absolutely possible and even probable in our veterinary population, or there's something else that's changing within the brain, like they have a slightly different change within their brain, neuropathologically speaking. Again, that could come from genetics. So absolutely, we don't know that yet. That hasn't been shown because, again, there's only one paper in veterinary medicine on trigger seizures right now. It's still kind of a relatively new idea, but that is a great thought and possible.
Great, thank you. Is there anything that can be done to help a dog that seizes while they're sleeping?
Yes. So the best thing to do for a dog when they're having a seizure, whether they're sleeping or not, is avoid as much stimulation as possible. So as you can imagine, especially at night, you want to turn the lights on. He's having a seizure. All of that stimulation can actually make seizures worse. So if you can keep the lights low, keep voices low, no extra sounds. For example, in the clinic, we'll actually put cotton balls in their ears to try and reduce the amount of stimulation from hospital noise. And importantly, protect yourself and other pets and children from dogs seizuring. I have had owners go to the hospital for bites and scratches with trying to pet their dog, and especially getting near their mouth. They are not conscious, not in their complete awareness when they're having a seizure. So even the friendliest of dogs could potentially bite you on complete accident. Also, some dogs, when they're having a seizure in the postictal periods, that time period right after, they will feel really vulnerable. And so they may get a little bit snappy, again, just trying to protect themselves because they feel vulnerable. But as far as truly stopping the seizure and shortening it, nothing has been shown to be significant in vet med thus far. As far as like things that we can do, there are medications that we can give sometimes in certain situations.
Thank you. How does the gut play a role with seizures? Some dogs seem to have a tendency to vomit bile and then seize with an upset stomach. Can you talk about that a little bit?
Yeah, so those are kind of two different things, which I know it probably sounds nuanced, but a lot of dogs in the pre-ictal period, so right before a seizure or during the ictal period, they will vomit, urinate, defecate, and or hypersalivate or drool excessively. And people with seizures, with epilepsy, report in that little few minutes right before the seizure, they feel really odd. People report an intense headache. People report nausea, and you may have heard this smell of burnt toast is also in the few seconds to minutes. So we assume that dogs are the same thing. They just feel this intense weirdness that's about to happen, and so that manifests in different ways. As far as the gut microbiome and role in seizures, that's what we're looking at now with our new study with probiotics. And in humans, because a lot of the your lymph nodes and your immune system lives within the gut. And so, and definitely, you know, if your GI is inflamed, then your body generically can be inflamed too. And so we're trying to see if we can make a more healthy microbiome, perhaps there'll be less inflammation in the body overall and less likely to have seizures. So we'll see if that holds true for our canine population.
That makes sense. The final statement is the Otterhound breed is probably limited to about 1,000 dogs worldwide. The gene pool is very limited. Seizures have been an ongoing problem with our breed. We'd all like to do our best to move forward with healthy dogs. Is there any advice you have for breeders?
Yeah, so I know that this can be tricky, especially with Otterhounds or some Otterhounds having a more late onset, i.e. after breeding has happened. But the general rule of thumb for all breeds is if you can avoid lines with known epilepsy. We don't have great genetic charts yet to say what the incidence will be. So if you've got a parent with epilepsy that one of them, and then they have a litter, how many will be affected, how many of the litter, we don't have any of that. But as a rule of thumb, if you can avoid dogs in the future, breeding dogs in the future that have seizures, that's going to be the best way to get it out of the line. But I completely understand that that's hard to do, especially if they're 6, 7, or even older when they're starting to have those seizures. By then they've had litters already. And that's unfortunately how some of these diseases can get in the lines when they show up later on in life, because you don't know until they show up. But the best thing to do would be to avoid breeding those if you can.
Following up on that, how far up the line would you recommend staying away from? So if a dog's so say you have mama dog and her litter mates, or 1 or 2 or just one, has a seizure, would you then not use that bitch?
Yes. So again, a general rule of thumb would be to avoid 2 lines up. So like going to that mom dog and grandma dog and using one further up over the line, if you will, like on the other side. And yes, even avoiding that pairing again will be helpful. The problem with avoiding that pairing is if they don't have seizures, you don't know who it is, if it's the male or female. And so that's another reason to go one more level above, so that you're kind of taking that out, making it less significant.
Great. As breeders, that's helpful information.
Yeah.
Becky, do you have any additional questions for Dr. Cameron? That was all the questions that we had during the chat or prior.
Great.
Oh, wait, one more, just a minute. Here's a question. Dr. Bell and Dr. Patterson looked at Otterhound database and pedigrees and recommended avoiding breeding Otterhounds with more than 20% of the litter mates seizing.
Mm-hmm.
Yeah, more of a comment. That's from
Yeah.
one of our
Absolutely.
one of our breeders is a veterinarian, and that is from our vet, Joey Gregory.
Excellent.
So Becky, is there anything that you have to add?
I think Dr. Cameron has done a fabulous job sharing with us about her research, and we really appreciate her time and efforts that she's put into this. And so all I want to say is thank you.
Oh, thank you. Thank you.
I
It's
agree.
really been a pleasure.
I agree. Fabulous job. We certainly appreciate it. Huge thank you. For everybody that's participating, the recording of this presentation will be on the Otterhound Club of America's YouTube channel. And please consider donating to Dr. Cameron's research. I'll provide the link and specifics in the email that I've send to follow up with tonight's presentation. If there's anybody on the call that has any additional questions, feel free to open up your mic and ask it.